Hello, everyone. It's a pleasure to be here today with you. And one of the many things that I really appreciate about Janssen is our dedication to drive forward towards important conversations about patient care. And that includes going beyond the medicine and really talking about what are those patient needs. Janssen recently hosted a panel discussion at the Large Urology Group Practice Association's 2021 annual meeting. And it included several leaders in the urology community from several practices serving patients all across the country. And we talked about the changing landscape of the advanced prostate cancer care and how the urology community is adapting to make sure that they are supporting patients and the needs of their teams. During the panel, I was struck by the similarities in what I heard from our panelists. They are seeing more advanced prostate cancer patients than ever before. And coordinating treatment, monitoring care, and managing the disease has proven to be more complicated than they've seen. But despite these complexities, they've been able to improve patient outcomes. They've also been able to reach at-risk communities and better connect the dots in advanced prostate cancer care. And how have they done that? They've taken a step back and asked a really important question. What can we do as a practice to shape the future for all of our patients? When we tackle pressing challenges, not as individuals, but as members of a community who are dedicated to learning and adopting best practices, we can make a real difference for advanced prostate cancer patients. Well, Janssen in Urology, what do we want to do? Well, we want to be an ally and we want to be a collaborator for those in the urology community who are making efforts every single day to help patients and their communities. Inspired by our mission to reimagine care so patients can redefine living, Janssen is dedicated to listening and to learning from the urology community. And this is all to make sure that we are helping to transform the future of urology care. I'm looking forward to highlighting some of the key takeaways from that discussion with Dr. Michael Bivins, president of the Urology Centers of Alabama, Dr. Gordon Brown, who is the director of the New Jersey Urology Center for Advanced Therapeutics in New Jersey Urology, Dr. Benjamin Lowentritt, the director of the Prostate Cancer Care Program at Chesapeake Urology, and of course, Natalia Gonzalez, who is the pharmacy manager at Urology San Antonio. Can you describe why urologists and the urology care team play such an important role in advanced prostate cancer care? And in addition, one last thing to that question while you're thinking about it, how is the urology clinic uniquely positioned to manage this disease?
We are truly the gatekeepers of this patient population. These patients have been in our practice oftentimes from their initial evaluation for an elevated serum PSA through their primary treatment and subsequent biochemical recurrence, and now unfortunately to advanced prostate cancer. So we're uniquely positioned to manage this patient population because we oftentimes have a long-standing relationship with these patients and their families and caregivers. That allows us to, I think, easily transition them from localized disease, and in that setting where these patients do develop advanced prostate cancer, they're very comfortable with our care. They're comfortable with the environment and the setting, and it helps us kind of transition them into advanced therapeutics. We've allowed ourselves to kind of do what's best both for the patient and the practice by referring these patients into centralized areas of specialty care so that they are able to undergo the evaluations that are required.
How has your practice adjusted its care model to make sure that there is consistency in patient care? And one more part to that question. Why is consistency in advanced prostate cancer care so vital to patients?
We're a big practice, and in order to get some consistency of care across a number of different sites, we established a number of different protocols and actually developed a decentralized model of having advanced practice providers lead clinics in each location. The core of this is that if it were you or your brother or your father, we want them to be going to a place where we know they were being offered the highest level of care. So our goal has always been, even though we operate out of multiple different offices, that we're offering that same level of care and expertise everywhere you can show up.
What do you observe are the biggest disconnects between patients and your urology care team that gets in the way of patient care and brings that challenge of consistency from patient to patient?
Number one issue is communication amongst the practice. The urology care team is made of so many moving pieces. You have people in the auth department, you have people in the billing department, you have the physicians, you have the pharmacy, and it's just been extremely difficult to make sure that everybody has the information they need and there's a disconnect. So I think one of the biggest things that we've done is actually assembled a dedicated team for prostate cancer. We meet once a quarter so we can kind of communicate what's going on and what's happening. And I think also another great thing that we've had is our prostate cancer champions have always openly expressed that there's an open door policy. And I think that's really encouraged staff, from MAs to nurse practitioners to really voice their opinions.
What do you believe is the greatest unmet need in advanced prostate cancer care? I also want to understand more about how can the urology community better collaborate to make sure that you are addressing this unmet need?
It's just heartening when men show up and they got a PSA of 2,000. There are a lot of doctors' offices that man has passed along the way. There are a lot of blood draws that man has passed along the way. One of the challenges that I see is that African American men, and men in particular, don't get engaged their healthcare until a little bit older or when there's an actual problem. And so trying to get that mindset early on to just make your health a priority. And that's how you get men that start to get screened earlier. They understand sort of kind of the mindset of let me prevent problems, so prevention, as opposed to trying to fix when something goes wrong. So educating is critical. Educating early and often, I think, are ways to certainly try to improve this issue.
Okay, let me ask this question. As you look ahead, what do you see next? What's next for the urology community as it continues to evolve in its approach to advanced prostate cancer care?
So when we're looking at it from a global, from a macro level, is educate. So because we got areas that are still, they're still not as up to speed and don't have the access that some of our more urban areas have. How do we top to bottom make sure that everybody is have full access and producing the same level of care? And what are the challenges in these smaller areas that we may be able to help them overcome? And what are they doing in those smaller areas that sometimes when you have challenges, you figure out ways to sort of kind of, overcome those challenges, which may be something that at larger practices like mine, we can utilize. So communication, education, continue to be on the cutting edge of technology. I think those are the major things that we do. We continue to do and try to learn what better ways to do them going forward.
Thank you, Dr. Bivins. and Dr. Brown and Dr. Lowentritt. And thank you, Natalia. Each of you have shared some really important insights on ways we as a community can better support advanced prostate cancer care. For each of you and at Janssen, I know that patients are at the heart of all we do. This is a time of making great leaps forward in treating advanced prostate cancer. At Janssen, being in urology means we are living the promise of our mission to reimagine care and redefine living. And by helping to forge stronger connections with you and the rest of the urology community, we can find new ways to help address challenges for urology care and the teams associated with it. And for me, today's discussion really reinforced the crucial role the urology community plays in the advanced prostate cancer care continuum. From providing holistic patient support to ensuring consistency of care, urologists and their care teams are driving innovations for patients that go beyond the medicine. It's inspiring to us, it's inspiring to all. And as we strive to do more, we want to make sure we continue to meet the needs of patients. Thank you, everyone, for listening.